I think the biggest change in treatment, or it's more of a management of a chronic disease, so Crohn's and ulcerative colitis. In the past, we haven't implemented people like psychiatrists, psychologists, social workers. Now, by utilizing that workforce, we're improving outcomes for our patients and reducing cost. It's interesting that stress probably plays a role with all chronic care diseases. So for Crohn's and ulcerative colitis, it's which came first, the chicken or the egg. So having Crohn's or ulcerative colitis can be stressful. Stress leads to more inflammation and symptoms. But there is also the question as to whether or not stress may somehow trigger Crohn's or ulcerative colitis. So it's probably an important factor in at least 50% of patients. So I don't think you can eliminate stress. That would be wonderful to have a magic wand that eliminates stress. But the psychiatrists, psychologists, and social workers that we're working with in our medical home, this inflammatory bowel disease home, are looking at helping patients cope with stress, so medical coping of stress through things like cognitive behavioral therapy. So it's almost like retraining the brain. So how do you retrain the brain around stress, which may improve outcomes in terms of Crohn's and colitis? Clearly, people who have stress triggers at work, at home, in school, that impact the quality of their life, their ability to attend school or work, that can be a big problem. So what we've done, and our psychiatrist is really leading the way, is meeting with these patients and working with them through these behavioral counseling sessions. So when they are encountering stress at work or school, they're not getting sick and going home. They're not missing school, they're not missing work. And there are ways to do that, and primarily through cognitive behavioral therapy, and like I like to say, almost retraining the brain around the stressful event. It's interesting, stress clearly cascades into other parts, so diet, nutrition, exercise. Some of these actually have some stress management components, so clearly exercise will help stress. Improving stress will reduce inflammation and symptoms as well, so that's a big part of it as well.